There are common surgical procedures you have probably heard of, such as appendectomy, caesarean section, cataract surgery, or coronary artery bypass. All these surgeries are extremely important and can save a person's life, but there are some procedures that are more complex and unusual, which really highlight the remarkable progress made in the medical field. The first surgery I will talk about is rotationplasty. This is an extraordinary form of reconstructive surgery that enables the ankle to be used as a knee joint. It involves the removal of the bottom of the femur, the knee, and the upper tibia. The lower part of the leg is then rotated 180 degrees and attached to the thigh. It is most commonly performed in children who have malignant bone tumors, such as osteosarcoma or Ewing sarcoma, a cancerous tumor that grows in the bones or in the tissue around the bones. The main aim is to fully remove the tumor in a way that allows the child to have an active lifestyle. Next, we have osteoodontokeratoprosthesis, which is often referred to as tooth and eye surgery as it involves using a tooth to restore a patient's sight. It is used for patients whose blindness is caused by irreversible damage to the cornea, which is the outer layer of the eye, and for whom other treatments have failed. The procedure involves the removal of a patient's canine or premolar tooth and the surrounding bone, and the patient's own tooth is used to reduce any chances of rejection. A hole is then drilled into the tooth and a plastic lens is inserted. The lens tooth structure is then implanted into the patient's cheek where it grows new blood vessels over a few months, and is later removed from the cheek and implanted to the eye. Light is then able to travel through the lens, restoring the patient's vision. Now for heart transplants. Conventionally, a heart transplant involves removing a patient's damaged heart and replacing it with a healthy donor heart. But what if a patient's body is likely to reject a donor heart, or the donor heart cannot function alone? This is where heterotopic heart transplantation comes in. Heterotopic heart transplantation, also known as piggyback heart transplantation, involves implanting a healthy donor heart on the right side of the recipient's damaged heart. Both hearts are attached, allowing blood from the damaged heart to flow into the new one, and the new heart can then pump blood around the body. Another weird yet wonderful surgery, hemispherectomy, involves the partial or total removal of one of the two hemispheres of the brain. It is considered a radical procedure and can take as long as 12 hours to complete. It's usually performed on individuals who have neurological disorders that cause seizures on one side of the brain, such as severe epilepsy, perinatal stroke, hemimegal encephaly, where one side of the brain is larger than the other, Sturge-Weber-Dimitri disease, which is characterized by facial birthmarks, glaucoma, and seizures, or Rasmussen's encephalitis, which is inflammation of the cerebral cortex. A very recent astonishing surgery is a head transplant, which is believed to be a possible cure for paralysis caused by neurological or muscle wasting disease. And the procedure, named Heaven Gemini, will involve removing the heads of the recipient and a healthy donor using an ultra sharp blade in order to avoid spinal cord damage. The recipient's head and the donor's body will then be placed into deep hypothermia for around 45 minutes to reduce nerve damage. The recipient's head will then be attached to the donor body using spinal cord fusion. I hope that you enjoyed my series of videos and take a deeper interest in the amazing medical and technological advancements the world has made.